Our dogs are more than just pets. They're family, and their well-being is our top priority. That's why it's so important to talk about Parvo. Parvo is a serious and highly contagious threat, especially for puppies and unvaccinated dogs who are most at risk. This aggressive virus can strike quickly and be fatal in just a matter of days if not treated promptly. It's heartbreaking to see a once playful puppy become so weak and ill. But here's the good news: knowledge is power. By understanding what Parvo is, learning to spot the early warning signs and knowing how to prevent it, you can make a real difference and potentially save your dog's life. Parvo isn't just a simple stomach bug, it's a devastating virus that attacks a dog's body from the inside, causing severe vomiting, diarrhea, dehydration, and even organ failure. I've witnessed the heartbreak Parvo can cause in families, but I've also seen the hope and relief that comes with prevention and early action. Responsible ownership, like making sure your dog gets timely vaccinations and practicing good hygiene at home, are your best defenses against this deadly disease. In this guide, I'll walk you through clear, practical steps you can take to protect your dog so you feel confident and prepared. We'll cover how to recognize the early warning signs of Parvo, so you can act fast if you ever notice something unusual. You'll learn exactly what to do in an emergency, including when to seek immediate veterinary care. And I'll explain how to work closely with your vet to give your dog the best possible chance at a healthy, happy life. Prevention is always the ultimate goal. Keeping your dog safe from Parvo means more years of joyful moments together. Vaccines are our most powerful weapon against Parvo, and staying up to date with them is crucial. By the end of this guide, you'll have a clear, step-by-step plan to keep your dog safe and healthy for years to come. Let's get started together and make sure Parvo never threatens your best friend. Your dog's health and happiness are worth every effort. Canine Parvovirus is a highly contagious virus that attacks a dog's intestines and immune system. It destroys the gut lining and weakens the body's defenses, making recovery difficult without medical help. Parvo is tough. It survives for months in the environment and resists most cleaners. Dogs catch it from contaminated feces, surfaces, or even on your shoes. Puppies between 6 weeks and 6 months are most at risk, especially before their vaccines are complete. Certain breeds and unvaccinated adults are also vulnerable. That's why vets urge you to avoid dog parks and public places until your puppy's vaccinations are done. Parvo isn't airborne, but it's everywhere. Constant vigilance is key. Recognizing Parvo symptoms early can save your dog's life. The first sign is sudden, severe lethargy. Your playful puppy becomes withdrawn and weak. Next comes vomiting, often forceful and frequent, followed by foul-smelling, sometimes bloody diarrhea. These aren't just stomach issues, this is a medical emergency. Dogs with Parvo quickly lose their appetite and may refuse water, leading to dangerous dehydration. You might notice pale gums, fever, or even a drop in body temperature. Abdominal pain is common. Your dog may cry out if touched. Symptoms can escalate in hours. Don't wait to see if they improve. If you see these signs, especially in a puppy or unvaccinated dog, call your vet or an emergency clinic immediately. Tell them you suspect Parvo so they can prepare. Fast action gives your dog the best chance of survival. Never try to treat these symptoms at home without veterinary guidance. Parvo is one of the most dangerous viruses a dog can face, and it's so deadly because it attacks your dog's body on two devastating fronts: dehydration and immune system collapse. This double assault is what makes Parvo so difficult to survive without immediate help. The first attack comes from relentless vomiting and severe diarrhea. These symptoms cause your dog to lose huge amounts of fluids and essential electrolytes in a very short time. As the body becomes more and more dehydrated, blood volume drops and the heart struggles to pump enough blood to vital organs. This is called hypovolemic shock, and it can happen frighteningly fast. Without rapid intervention such as IV fluids to replace what's lost, your dog's organs can begin to fail. In many cases, death can follow within just a day or two if treatment isn't started right away. But Parvo doesn't stop there. At the same time, it attacks the bone marrow, destroying white blood cells that are crucial for fighting off infections. This cripples your dog's immune system, leaving them defenseless against other threats. With the gut lining damaged, bacteria from the intestines can leak into the bloodstream, causing sepsis, a life-threatening body-wide infection that can overwhelm even the strongest dogs. In very young puppies, a rare and even more dangerous strain of Parvo can attack the heart muscle directly, leading to sudden and unexpected death, sometimes with little warning. The combination of severe dehydration, Overwhelming infection and in some cases heart damage makes Parvo a true race against time. Every minute matters when it comes to saving your dog's life. Only aggressive, professional veterinary care, often involving hospitalization, IV fluids, antibiotics, and constant monitoring, can give your dog a fighting chance to survive this brutal disease. This is why immediate veterinary intervention is absolutely critical. Every hour that passes without treatment increases the risk of irreversible damage or death. Don't ever underestimate how quickly Parvo can overwhelm even a healthy, energetic dog. The change can be shockingly sudden. Recognizing the signs and understanding the urgency helps you act fast, which can make all the difference. Your quick action and awareness could be the reason your dog survives. Remember, your dog's life truly depends on it. There is no home cure for Parvo. Hospital care is essential. In rare, mild cases or during recovery, your vet may guide you on supportive care at home. Hydration is the top priority. Offer small amounts of water or vet-approved electrolyte solutions. Never force fluids. Let your dog drink at their own pace. If vomiting stops, your vet may recommend bland food like boiled chicken and rice, starting with tiny portions. Keep your dog warm, comfortable, and isolated from other pets. Disinfect everything with a bleach solution. Parvo is extremely contagious. Wash bedding, bowls, and toys thoroughly. Monitor for any worsening symptoms and stay in close contact with your vet. Strict hygiene protects other dogs in your home and community. Only follow home care instructions from your veterinarian. If your dog worsens, return to the vet immediately. Your vet is your lifeline. Never try to manage Parvo alone. At the hospital, your dog receives intensive, life-saving care. IV fluids restore hydration and stabilize blood pressure. This is the cornerstone of treatment. Anti-nausea medications control vomiting, while antibiotics prevent deadly secondary infections. Vets monitor vital signs and blood work around the clock. If your dog can't eat, nutrition may be given through a feeding tube. There's no drug that kills Parvo directly. Supportive care buys time for the immune system to recover. With prompt, aggressive treatment, survival rates can reach 90%. Treatment is costly and emotionally tough, but it saves lives. Early intervention makes all the difference. Trust your veterinary team. They're fighting for your dog every step of the way. When it comes to Parvo, prevention truly is your best defense. This highly contagious virus can strike quickly and be devastating, but with the right steps, you can keep your dog safe and healthy from the very beginning. Vaccination is absolutely essential. Every puppy should receive the Parvo vaccine starting as early as 6 to 8 weeks old. These initial shots are just the beginning. Your puppy will need booster shots every few weeks until they're at least 16 weeks old. This schedule helps build strong, lasting immunity. Until your puppy's full series of vaccinations is complete, it's important to avoid high-risk places like dog parks, pet stores, and anywhere lots of dogs gather. These environments can harbor the virus, even if they look clean. Instead, arrange safe playdates only with dogs you know are fully vaccinated, and always choose clean, private environments for your puppy to explore and socialize. Practicing strict hygiene is another key step. Always wash your hands thoroughly, change your clothes if you've been around other dogs, and disinfect leashes, shoes, and any surfaces your puppy might touch after outings or visits to public places. If you're cleaning up after a dog with diarrhea or a dog whose health history is unknown, use a bleach solution to disinfect floors and surfaces. Parvo is tough and can survive in the environment for months, so thorough cleaning is crucial. Your choices matter. Be vigilant about where your dog goes, who they meet, and what they come into contact with. A little caution goes a long way in keeping your pet safe. Stay on schedule with all veterinary visits and booster shots, not just as a puppy but throughout your dog's life. Regular boosters help maintain their immunity and keep them protected year after year. Good habits and timely vaccines are your dog's shield against Parvo. They're simple steps that make a world of difference. Remember, Parvo is preventable. Don't let your guard down even for a moment. Your vigilance is your dog's best protection. Your veterinarian is your partner in prevention. Don't hesitate to ask questions or seek advice. They're there to help you every step of the way. By taking a few smart, proactive steps, you can spare your dog and your family immense pain, worry, and heartache. Protect your best friend, and you'll enjoy many happy, healthy years together, filled with love, adventure, and peace of mind.